Hello, good morning. I am Dr. Manjunath Malige. I am the Chief Endocrinologist and Diabetologist at Astra RV Hospital, JP Nagar, Bangalore. On the eve of this World Diabetes Day, year 2020, I would like to talk to you about one of the most topical topics that's been discussed throughout the world now, and that's about diabetes and COVID 19. There are quite a few questions that I get asked in the clinic whenever I see patients, and I have formulated these questions under various common headings so that I can answer these questions better. Now, the way I would like to present it to you is I'm going to first state the question so that you know what I've been asked, then I'm going to answer that question myself. So, the first question is COVID 19 infection more common in diabetes patients? It certainly is. COVID 19 infections are slightly higher in diabetic patients because diabetes itself is an immunocompromised state, which means the immune system or the defense system of the body is a bit weaker in diabetes patients compared to non diabetes patients. That's number one. The other question is, if a patient with diabetes gets COVID 19 infection, is there an increased risk of developing complications due to COVID 19 infection? Yes, there is certainly an increased risk of developing COVID 19 infection complications like respiratory failure, heart failure, requiring intubation, oxygenation, and various other system malfunction in the body, be it lungs, kidney, or the heart. And the reason for this is again, as I said, the immune function is a bit lower in diabetic patients, and secondly, as soon as any diabetes patient catches any infection, be it COVID or any other infection, the first response of the body is to increase the blood sugar levels. You might have seen this yourself in sort of if someone has a skin infection or a urinary tract infection, the blood sugars do go up. And for this reason, the risk of complications due to COVID infection in a diabetic patient is certainly high. What is the care that needs to be taken with regards to diabetes management if one has COVID infection? Now, if you have a COVID infection and you've been advised by your doctor that you do not need any particular treatment and you can be home quarantined, then that's good. You don't sort of need to be too conscious of the fact that you have a COVID infection because you are asymptomatic. But what you need to be aware of is that because you have an infection, there is a good possibility that your blood sugars can still run high. So I would suggest that you check your blood sugars regularly with a glucose meter at home, preferably fasting, and maybe about 2 hours after lunch and 2 hours after dinner, so that you know that the blood sugars are under control or running high. So what are we looking at? We are looking at some numbers like this. We want the fasting sugars to be anywhere between 90 to 130, and 2 hours after food sugars to be around 140 to 170. Yeah. So if the blood sugars are particularly running about 200, you will have to see your endocrinologist or diabetologist for further advice about blood sugar management. Now, on the other hand, if you have COVID infection and if you are admitted in the hospital, there is a good chance that the doctor might have started you on a particular medication called as steroids. These go by different names like methylprednisolone, solumetrol, hydrocortisone, dexamethasone, and prednisolone. So, irrespective of which name they all have a common characteristic of increasing the blood sugar levels in patients. Now, this can even happen in non-diabetic patients. So, if you were to have COVID 19 infection and if you are started on these steroids, you please expect that your blood sugars are going to go high. And it is important that an endocrinologist takes care of your blood sugars, and you might end up needing insulin temporarily, at least as long as you are on these steroid medications. Once you are off the steroid medications, you perhaps may not need insulin if your blood sugars are well controlled. Now, the other question is COVID 19 infection in a pregnant diabetic woman. If you are pregnant and you have either gestational diabetes or pregnancy diabetes, and or previously known diabetes, you need to be a bit extra careful, and you need to be sort of seeing your endocrinologist early and a bit more frequently, aiming for a tighter blood sugar control, because this has a lot of implications on not just your health but also the health of the growing baby. So with this I would stop here, but if you have any questions, please let us know and we'll try and answer that in future. Thank you for watching.